Good afternoon, everyone. We are going to officially get started. This is Josie Silverman Mendez. I work on the Community Partner Outreach Program and specifically support the I'm Healthy Soy Sano program. I'm joined in the room by
Colette Bird. I'm the Provider Campaign Coordinator with the Community Partner Outreach Program.
Welcome to our webinar, Introduction to REALD. We're really glad that you tuned in this afternoon. Just to let you all know, we will not be taking questions live during the webinar, but do feel free to type your questions into the webinar menu panel. We will use those questions to help inform future training that is currently in development. This Introduction to REALD is just that. It's intended to be a quick primer on what REALD is and why it's important, and we will also be presenting some additional trainings and supports that will be coming to you over the next month or so. I'd also like to highlight that we, the Community Partner Outreach Program, we have partnered with the Office of Equity and Inclusion here at the Oregon Health Authority to develop this primer and the future trainings that will be available to all of you. The objectives for today's webinar: we are going to identify the new REALD questions that are now contained within the One System applicant portal. We will then learn about REALD, so what is it, why it's important or why it matters, and again touch on some future training and additional supports that are in development and that will be released here soon.
So let's talk about the questions themselves, what they are and where they are in the applicant portal. First and foremost, we want to recognize that we wished we could have gotten information to you all quicker than we did. For many of our assisters, these questions just appeared in the applicant portal without any notice, and we apologize for that. We are doing our best to catch up and make sure that you are armed with the tools you need to help clients navigate these questions. This webinar is the first step in getting you that information. You all as application assisters are critical in helping us get this information into the system. You are frontline data collectors, and we thank you for that. We also want you to know, and it's important for clients to know as well, that these questions do not affect eligibility. So there are many questions in the applicant portal and in the OHP application that do, but these REALD questions do not affect eligibility for OHP programs. The first question is, how does this individual identify their race, ethnicity, tribal affiliation, country of origin, or ancestry? As you can see, it's a blank field, so that allows the applicant to identify however they see fit. Next, it says racial or ethnic identity, select all that apply. To help ensure that all members receive quality care, the best services possible, and equal treatment, we are asking all members about their racial and ethnic identity. So each of these categories, if you select the arrow, offer sub-race and ethnicity category options. And so within each of these categories, the applicant can further identify within those subgroups. They can also decline to answer, but we will talk about why it's important as much as possible for applicants to answer these questions. The next question is, how well do you speak English? The next is this individual deaf, or does this individual have serious difficulty hearing? Is this individual blind, or does this individual have serious difficulty seeing even when wearing glasses? Because of physical, mental, or emotional condition, does this individual have serious difficulty concentrating, remembering, understanding, or making decisions? Does this individual have serious difficulty walking or climbing stairs? Does this individual have difficulty dressing or bathing? Because of physical, mental, or emotional condition, does this individual have difficulty doing errands alone, such as visiting a doctor's office or shopping? Is this individual limited in any activities because of physical, mental, or emotional problems? The next three questions have already been part of the OHP application and have already been in One prior to the REALD question additions. In what language do you want us to speak with you? In what language do you want us to write to you? Do you need written materials in alternate format? The REALD questions are underneath that. Do you need an interpreter? Do you need a sign language interpreter? So the applicant is answering those questions to the best of their ability. However they identify is how we want them to answer. And our training that is coming up that we will be offering in the next month or so will dive deeper into how to talk through those questions with clients.
So now we're going to talk about REALD and explain what it is exactly. So it is an acronym. It stands for Race, Ethnicity, Language, and Disability. And it specifically points to a set of standardized questions that collect data on those things. So a set of questions that collect data on race, ethnicity, language, and disability status. It's important to highlight that when we're collecting this data, we're really doing it for population-level demographic purposes and are less concerned with individual information, which is why this doesn't impact eligibility or anything related on the individual level. We also know that REALD is an incredibly valuable tool for uncovering what we call health disparities or avoidable or preventable differences in health outcomes that can be experienced by different populations or subpopulations. To make this a bit more tangible, we've included two examples of health disparities in this primer. So in this first example, we're trying to show how patient demographic factors such as their health insurance status, their racial ethnic background, and their gender identity impact access to health care. So this is a local study actually that was done in 2015 by Portland State in collaboration with Oakland University. And what the researchers did is they simulated patients that had distinct health insurance, again, racial, ethnic, and gender profiles or backgrounds. They then called randomly a set of physicians across the country trying to get an appointment. And here's what they found. A white male self-pay patient, so a white man who's uninsured, was able to get an appointment with a physician 70% of the time. In stark contrast, a Hispanic female patient on Medicaid was only able to get an appointment with a physician 14% of the time. So what the researchers concluded is that there's bias, whether it's conscious or unconscious, within the healthcare system that is directly impacting a patient's access to care. This next example is also a local example that comes out of Multnomah County. So in 2014, Multnomah County released a report card on racial and ethnic disparities. And they looked at the Asian Pacific Islander group as a single group and compared their health outcomes against other groups of color. And they looked at 33 different indicators in terms of health outcomes or social and well-being outcomes. What they found was when Asian and Pacific Islanders are grouped together as a single group, they fared better than other groups of color in those 33 indicators. So what researchers did, they came back in 2015 and they detangled, if you will, Asians from Pacific Islanders, and they looked just at the Pacific Islander group alone and then re-examined how they fared in some of those indicators that were looked at originally. So they looked at 11 of the 33 original indicators. And here's what they found. Again, when Pacific Islanders were teased out from Asians as a population. 6 out of 11 indicators presented a significant disparity, so an avoidable difference in health outcome for Pacific Islanders. 3 examples that we've included here. Pacific Islanders, again, when compared to other groups of color in Multnomah County, experienced higher rates of teen pregnancy, higher rates of pregnant women not accessing prenatal care in the first trimester, and finally, higher rates of low birth weight babies. So again, what we're trying to show here is that health disparities can in fact be masked when we don't collect more granular or detailed data when it comes to racial and ethnic groups. So this is a pretty compelling example of that. Understanding the bigger picture. What we're trying to highlight here is that OHA's new REALD standards did not come into an existence overnight, but in fact were part of a larger context and effort that actually began in 2000. So at that point in time, Oregon's governor identified data collection of race and ethnicity as a priority for the state. Then in 2011, at the federal level, the Department of Health and Human Services established a set of data collection standards for race, ethnicity, primary language, and disability status per a new requirement in the Affordable Care Act. Then in 2013, back here in Oregon with leadership from the Asian Pacific American Network of Oregon, or APANO, and the Oregon Health Equity Alliance out of Portland, they were able to successfully advocate for the passage of House Bill 2134, and that bill was signed into law and specifically called for more granular or detailed data collection as it related to REALD here in Oregon. Then in 2013 and 2014, a rulemaking advisory committee was put together by OHA, and that committee really came together to develop the standards that we have today. Then in 2015, funding was allocated for implementation of the new REALD standards to make sure now both OHA and DHS are in compliance or have a plan to become compliant moving forward. And then in 2016, both OHA and DHS hired new REALD staff to work on a very large body of work. And then lastly, in 2017, as you all know, the new REALD questions were embedded in the one system, and so now one is fully REALD compliant based on Oregon's new standards. Some additional context regarding Oregon. So we wanted to underscore that, again, these questions didn't come out of thin air. They really were the result of a community-driven initiative to ensure that both OHA and DHS that were collecting data in a way that really represents the diverse communities we serve and their lived experience and health outcomes. So the questions have been heavily validated and tested. That was part of the rulemaking process, so there was a lot of public testimony, listening sessions, and other things that went into the development of the actual rules. In terms of selection of questions, some of those have come from federal sources, so from Department of Health and Human Services, or the American Community Survey, which some folks on the call might be familiar with. And other questions have come from the American with Disabilities Act, and other best practices that we can point to federally in terms of collecting this data and asking the question. As we all know, again, the REALD questions are now included in the one applicant portal. You've probably noted that you don't see the same questions on the paper application or the fillable PDF application. We are expecting that those will be fully updated come this fall, and we will continue to keep you posted on that timeline. So why does REALD matter? Why is this important? So again, we talked about REALD as a tool. We know it's foundational to understanding causes of health disparities. And specifically, we know as we're collecting it, and we're collecting it at a granular level, it can be really helpful for designing population-specific interventions and then evaluating our progress. Are we actually moving the dial on reducing and or eliminating those experienced health disparities and really advancing health equity for various populations? So we've developed this schematic, again, thinking of REALD as a tool. So the first step in the process is to actually collect the data and to hopefully have a uniform, standardized way in which you're doing that. From there, you will analyze the data, and you'll be able to hopefully uncover if there are health disparities. You'll be able to identify that through the data. From there, once you're able to identify which populations are experiencing those disparities, you can then hopefully work with those populations to develop specific interventions to address those disparities. And then you evaluate, did that intervention work? Was it effective in reducing and or eliminating that disparity? If it wasn't, then you go back to the drawing board. So taking that schematic and applying another Oregon example, so we want to underscore here The data collection, it all really starts with the Oregon Health Plan application. So as Colette said earlier, our application assisters are super valuable frontline data collectors in this effort. This example specifically relates to coordinated care organizations and how they might use REALD, but there are dozens of examples that we could use here in Oregon. So as an example, OHA is collecting or is starting or will collect REALD data through the Oregon Health Plan application. They're then sharing that REALD data with CCOs through what are called member enrollment files that they get, I think, weekly at this point. From there, the CCO is using REALD to analyze health outcomes among their member groups and identifying potential disparities between or among those member groups. And then they're developing interventions to address those health disparities. Again, these are population-specific, tailored interventions to address why there's a difference in health outcome occurring. And from there, OHA and CCOs collaboratively are evaluating the outcome of those interventions. Are they working?
So let's talk about some training and additional supports that are coming your way. Your regional outreach coordinators are currently and have been collecting feedback from community partners through the July Regional Collaborative meeting. This REALD introduction is the second step to informing our partners about these questions and the why and the how. REALD training will dive a little bit deeper. So beginning in September, we will be hosting recertification training for our community partners, and a portion of that training will include a deeper dive into REALD and how to help applicants navigate these questions effectively. We'll also be developing REALD materials to help support you in navigating these questions with your applicants. And of course, your regional outreach coordinators will continue to be ongoing support to you all as community partners in your work. So the REALD training, again, that's coming as part of the recertification training for application assisters. The objective of this portion of the training is to share best practices for asking these questions. We've already been hearing from our assisters, our community partners throughout the state, different issues they've run into or different difficult conversations they've run into around these questions. And so we want our partners, all of you, to be confident in helping applicants navigate these questions. That will be one major objective of this training. We'll talk about best practices for addressing questions you might get from applicants around these REALD questions. And we'll talk about understanding the bigger picture in more depth and arming our partners in being able to explain the value of these questions to applicants who are answering these questions. So for active application assisters, as I mentioned, the REALD training will be part of the recertification training requirement for this year. Beginning in September, we'll host live webinars. We have the date and the time of day up there on your screen. The registration link is available here on the screen as well, so we will make these slides available to you all to register. Though our regional outreach coordinators are communicating directly with community partners in their region to inform them of when they'll be holding, when we'll be holding these webinars. In addition, once they've scheduled in-person opportunities for this training, they will also communicate directly to the community partners in their region to let them know when these trainings are happening and how you all can register. Now for new application assisters, also beginning in September, we will incorporate the REALD first into the OHA Certified Application Assister training. And it will be available every first Friday of the month. This has been in place for a while and we'll continue to host our first Friday training webinars. So community partners can register via group site. They can also reach out to the regional outreach coordinator to get more information on those trainings and the different requirements for becoming an application assister. So finally, we just want to share with you that we're really excited about these questions, and we want you to be as well.
Thank you all. We hope this has been a helpful introduction to REALD, understanding its importance. Keep an eye out again for the trainings to come starting in September, and we thank you again for tuning in this afternoon. Take care.